Oh, broken window. Oh my gosh. The unknown danger of traffic stops, snowplow catastrophes, and wholly submerged car, Batman. Today, we are breaking down real-life emergencies caught on camera. Let's dive right in.
It's dramatic, just released body cam video of cops arresting a teenage cheerleader for allegedly murdering her newborn baby while her mom questions cops. Cops say she left her baby boy in the trash in a hospital bathroom.
Wow. This actually does happen on multiple different levels. People potentially can deliver babies in bathrooms, at home, standing. This does actually happen. The biggest thing is don't leave it unattended. It needs help immediately. And you're at the hospital, so you have medical staff to help.
We discovered a dead baby in the bathroom. Oh my gosh. I'm sorry. He came out and he didn't know what to do.
Alexi says she had no idea she was pregnant and went to the ER for back pain.
The biggest things you worry about when a baby comes out is its airway. So you want to make sure that the airway is clear. We end up doing a bulb suction of the nose and the mouth to get all the amniotic fluid out of there and make sure it's clear. Let the baby scream, clean it off.
But is that believable? Check out this video of Alexi performing on her high school cheerleading squad less than 3 weeks before she gave birth.
I literally have had patients have said, I didn't know I was pregnant while they're delivering a baby. Sometimes people don't notice their body changing in the sense of maybe they're already a little bit overweight, so you don't see an increase in abdominal girth because it's being displaced or being shifted.
Tiberias police said they're releasing this difficult footage of an officer who is now doing okay as a warning about how dangerous fentanyl can be.
Yep, fentanyl is a synthetic form of an opiate made in a lab and it's very, very potent. And we use it at the hospital, made in a lab, FDA approved.
Courtney Sullivan with the Tiberias Police Department said Officer Courtney Bannock found drugs on a passenger during a traffic stop Monday night.
If it just gets a little bit aerosolized and you inhale it by accident, it can hit you very fast and you can have an opiate overdose by accident or not even knowing. The biggest thing that we worry about is respiratory depression.
Justin Marion, an athletic 41-year-old airline mechanic, told me he has no memory of his near-fatal heart attack a few weeks ago. In the middle of a barbell lift, he slumped to the floor. Gym co-owner Karen Camps rushed over to help. She started CPR.
First things that you do in somebody in this scenario, call 911, you assess the patient, you look, listen, feel. Are they breathing? Do they have a pulse? If they do not have a pulse, that is when you're starting CPR.
10 police officers Jimmy Butler and Patrick Duncan arrived with an AED and hooked it up to Justin, who was unconscious and barely breathing.
Depending on what their protocol is, you should be putting the pads on the right chest and left flank, or you can go front and back. If they are treating for pulseless activity, you have a VFib or VTAC with no pulse. You need to do CPR, and then you need to assess for shocking.
As Justin lay on the brink of death, Officer Duncan fires an electric shock to his chest. Butler starts CPR. Seconds later, Justin is breathing again.
They have an AED, an automated external defibrillator. This will actually shock or analyze the rhythm for you so you don't have to.
The AED that we have, the shock from that, and the CPR, thankfully brought him back.
Justin expects to make a full recovery from his heart attack. He says every police officer in the state should have an AED.
Then he needs to get an EKG. He needs to get a full workup to figure out why he had a cardiac arrest. In the news, they keep saying heart attack.
Heart attack?
A cardiac arrest and a heart attack are two different events. A cardiac arrest, your heart is not working appropriately. A heart attack, a blood vessel surrounding your heart is blocked.
It's dramatic body cam video from when former Bachelor TV star Sean
Whoa.
Lowe was viciously attacked by his own dog.
Dog bites are dirty, just like human bites are dirty, so they can puncture deep because of their big canines that they have. Really hard to clean those out, so it has a high chance of getting infected. So when it comes to these, you try to clean it out as best you can. Usually you'll be placed on antibiotics.
Took to Instagram, showing stitches on
Ouch.
both of his arms.
Pretty gnarly laceration to his wrist right there, and you can actually see some other puncture wounds that they didn't close up. Here on the wrist, you see multiple simple interrupted sutures with non-absorbable sutures there. Oh, broken window. Oh my gosh. Kids left in a car. You gotta be really careful. You can't leave people in a car or animals because the temperatures can rise. That's not sustainable with life if you're exposed for too long. Literally, I deal with patients that come into the emergency department with hyperthermia due to environmental exposures.
Cobb County Police in Georgia say the kids, ages 1 and 2, were left in the car for over 40 minutes. The temperature inside reached a sweltering 117 degrees.
It's super dangerous. It's deadly. You can get brain damage. You can die. It's not appropriate to leave people in a vehicle, even if you think it's only going to be 5 minutes.
Drop the hammer.
Whoa.
Nope. Hey. What is going on right now?
Suddenly, DePaul violently strikes Pelosi on the head.
I've seen the result of people getting hit with a hammer on the head, and it splits open the skin on your scalp. I haven't seen the skull get fractured from it, but it could. You want to clean the wound, assess for fractures. You're probably going to get a CT scan of the head to make sure there's no intracranial abnormality.
The men fall to the ground as cops quickly work to cuff the crazed attacker.
Give me your
If there's an open skull fracture to that area, a neurosurgeon needs to be involved. If there's no fracture, you can close up the skin, but you need to make sure that all the underlying tissue is still intact. If it is not, you might need to do a layered closure.
The dramatic body camera video shows first responders racing to rescue Jeremy Renner after a 7-ton plow nearly crushed the Avenger star to death.
He suffered a lot of traumatic injury all the way from the head to the toes. Ribs can break off and spike into the spleen, into your lung, into your liver, cause bleeding or cause your lung to collapse. And again, your face has very, sensitive bones, so they can crack pretty easily as well.
Medics are seen providing life-saving aid to Renner as deputies arrived to his Nevada property on January 1st.
I believe also him being in a cold temperature and being in the snow probably was beneficial for him in the sense of slowing some metabolic processes down and protecting his body, versus if he was not in that environment, things could potentially progress worse for him.
Renner was helping him get that pickup truck out of the snow when Renner got out of the plow to check on him, but the plow kept moving.
If watching these body cam emergencies just spiked your stress levels, you might want to check out Chillax. It's our fast-acting occasional stress support supplement from my company, Life Happens. Check it out at lifehappens.com or Amazon.
Renner broke more than 30 bones from his shins to his eye socket.
30 bones is a lot, and sometimes you could probably have multiple fractures of the same bone. When somebody gets run over, especially if the torso is involved, a lot of the ribs can just snap in a couple places. I've seen people that have rib fractures from 1 all the way down to 12 on one side.
One rib pierced his liver.
He is intubated and he's in kind of a rigid padded collar, most likely because he does have cervical fractures. He has an oral gastric tube going into his stomach to decompress it, because you don't want your abdomen to be filling up with gases and air and then get really bloated, increase the risk of regurgitation and vomiting.
He told our Diane Sawyer there were times he thought he wouldn't make it.
I shift the narrative of it being victimized or making a mistake or anything else. I refuse to be haunted by that.
Good insight into the mental state of an individual that has this type of trauma happen to him. He had physical trauma. Talking about it is actually a really good type of therapy to move beyond an event that happened.
2 emergency service workers are charged with first-degree murder.
What?
A man died following transport to a hospital.
Oh,
Police
no.
say when they arrived, they were told Moore was suffering from alcohol withdrawal symptoms.
The patient is possibly intoxicated. We don't know exactly. He might have a long history of alcoholism, versus is he altered for another reason?
Body cam video shows first responders inside his bedroom trying to get him to his feet, but he seems unable to walk on his own. One of the paramedics is in the room, but police say she offered no assistance.
We all have to think like, hey, is another human being, know that they're not of their sound mind and they may not be doing things on purpose. For us to get frustrated, we need to take a step back.
And the officers took turns carrying him out of the house.
When a paramedic goes into somebody's house or an EMT goes in the house and the individual can't get out on their own, they do have other mechanisms within the ambulance to get them out. There's a stair chair. There is other types of stretcher devices that you can bring into the house.
Once outside, the patient needed help getting onto the stretcher. After police helped get him on the stretcher, the other paramedic adjusted his position.
Onto the
Then both paramedics
abdomen?
secured Moore to the stretcher and took him to the ambulance.
Wow. He's placed face down on the stretcher. Typically, it's not an appropriate position. The airway is not protected, especially if somebody is altered. I've never seen anybody come in through the ambulance bay on a stretcher laying on their stomach.
He later died at the hospital.
Dr. Denton has listed the cause of death as compressional and positional asphyxia.
Damn it. Really sad. This shouldn't happen. Unfortunately, this does happen. Back in the day, before I was even a resident, they used to actually hogtie people, and not lying, they realized like there were bad outcomes in that position where somebody's on their stomach and really bad positioning. Interesting clips, and these are real cases and really interesting to go over, and I really hope that you guys enjoyed this and learned something from it. And if you did, I really want to know, because you know this is like real medical events that happen, and we should talk about it more so you guys can learn more. And if you guys enjoyed this, definitely check out this playlist right here, binge watch everything, and do me a favor, keep this channel growing, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.